Do you know what fatty liver is and how it affects your health? A pertinent question indeed, given the rising incidences of this condition globally. Fatty liver, more formally known as hepatic steatosis, is a condition characterized by the accumulation of excess fat in liver cells. Now, it's important to note that a small amount of fat is quite normal and expected in a healthy liver. However, when the fat content starts to make up more than 5 to 10% of the liver's weight, we're stepping into the territory of fatty liver. The liver, a vital organ, is responsible for several key functions in our body, including detoxification and metabolism. So imagine the impact if it starts getting weighed down by excess fat. It's a concerning thought, isn't it? Now that we understand what fatty liver is, let us delve deeper into its two main types. Non-alcoholic fatty liver disease, often known as NAFLD, is the most common form of fatty liver. It's a condition not associated with alcohol consumption, but rather it's closely linked with a variety of health conditions. Think along the lines of obesity, insulin resistance, type 2 diabetes, high cholesterol, and something called metabolic syndrome. Now let's delve a bit deeper into these risk factors. Obesity, especially around the abdomen, is a significant risk factor. The extra weight contributes to the accumulation of excess fat in liver cells. Insulin resistance, on the other hand, is when the body's cells don't respond effectively to insulin, causing elevated blood sugar levels. This too can lead to NAFLD. And speaking of high blood sugar levels, type 2 diabetes is another associated condition. Because diabetes affects the way your body uses blood sugar, it's often linked with NAFLD. Finally, there's metabolic syndrome, a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. This syndrome includes high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. All of these, when present together, can increase the likelihood of developing NAFLD. To sum up, NAFLD is a common form of fatty liver disease closely tied to conditions like obesity, insulin resistance, type 2 diabetes, high cholesterol, and metabolic syndrome. Now that we have a good understanding of NAFLD, let's move on to the second type of fatty liver disease. AFLD, or alcoholic fatty liver disease, is directly related to excessive alcohol consumption. You see, our liver is rather good at multitasking. It functions as a detoxifier, a nutrient storehouse, and an engine running numerous metabolic processes. However, when we consume alcohol excessively, it can overwhelm the liver, leading to the accumulation of fat in liver cells, a condition known as hepatic steatosis, or simply fatty liver. Now, it's important to understand that AFLD isn't just about having a fatty liver. It's a spectrum that ranges from a simple fatty liver to more severe conditions like alcoholic hepatitis and cirrhosis. Alcoholic hepatitis is a condition where the liver cells become inflamed due to excessive alcohol consumption. On the other hand, cirrhosis refers to the late stage of scarring or fibrosis caused by many forms of liver diseases and conditions, such as hepatitis and chronic alcoholism. The primary culprit behind AFLD is regular and excessive alcohol intake. When we consume alcohol, our liver gets to work, breaking it down so it can be eliminated from the body. However, this process produces harmful substances that can damage liver cells, promote inflammation, and weaken the body's natural defenses. Over time, if the consumption of alcohol isn't controlled, it can lead to the development of AFLD. Having understood both types of fatty liver diseases, let's move on to the symptoms and diagnosis. Fatty liver often has no symptoms in its early stages. Like a stealthy intruder, it sneaks into your body, setting up shop without so much as a knock on the door. But as this condition progresses, it makes its presence known. Individuals may start to feel fatigue, a kind of weariness that your usual cup of coffee can't shake off. Weakness may set in, making even simple tasks seem like Herculean feats. Abdominal discomfort may disrupt your day, an uninvited guest that overstays its welcome. And in more severe cases, the skin and eyes may take on a yellowish hue, a condition known as jaundice. But how do we catch this unwelcome guest? How do we diagnose fatty liver? The answer lies in imaging studies. These are like windows into your body, allowing us to see what's going on inside. Ultrasounds, Connecticut scans, or MRIs can reveal the accumulation of fat in the liver, like finding hidden treasure. Only in this case, the treasure is something you'd rather not have. In addition to these imaging studies, doctors may also conduct blood tests and liver function tests. These tests are like the body's report card, giving us a clear picture of how your liver is doing. They help assess if the liver is just having a bad day or if it's a sign of something more serious. Now that we know about the symptoms and diagnosis, let's move on to the treatment and management of fatty liver. The primary treatment for fatty liver involves addressing the underlying causes and risk factors. This is where lifestyle changes come into play. Let's start with weight loss. Achieving and maintaining a healthy weight is pivotal in managing fatty liver. It's not about unrealistic rapid weight loss, but a steady and sustainable reduction in weight that can significantly improve liver health. Next up is diet. Adopting a balanced, low-fat diet is key. This means plenty of fresh fruits and vegetables, lean proteins, whole grains, and healthy fats. Say goodbye to processed foods, excessive sugars, and unhealthy fats. Remember, it's not about deprivation, but about making smarter choices. Physical activity is another crucial factor. Regular exercise helps burn off the excess fat, improves insulin resistance, and boosts overall health. This doesn't mean you have to become a marathon runner overnight. Start small, with consistent walks, and gradually increase the intensity and duration of your workouts. Now, let's talk about underlying conditions. If you have diabetes or insulin resistance, managing these conditions is essential to treat fatty liver. Similarly, high blood pressure and high cholesterol need to be kept in check. Regular checkups and following your doctor's advice are key. For those dealing with alcoholic fatty liver disease, reducing, or better yet, stopping alcohol consumption is the most critical step. There's no workaround here. Alcohol is a primary cause, and its reduction is a non-negotiable part of treatment. By taking these steps, we can manage and treat fatty liver, leading to a healthier life. We have covered a lot of ground today about fatty liver. In essence, fatty liver is a condition where excess fat accumulates in liver cells, primarily divided into non-alcoholic fatty liver disease and alcoholic fatty liver disease. Causes range from obesity, insulin resistance, type 2 diabetes, high cholesterol, metabolic syndrome, to excessive alcohol consumption. Symptoms may be subtle, but diagnosis is possible with modern imaging techniques. Effective management involves tackling the root causes and lifestyle modifications. Remember, knowledge is the first step towards a healthier life. Stay informed, stay healthy.